So thanks so much, everybody, for joining us for our Thursday morning webinar on the special open enrollment period. We joked on NCAN staff that we were going to use the Wiz reference, brand new day, to name this webinar. I think for a lot of folks with the change in administration in DC, it does really feel like a brand new day in terms of the policy issues and healthcare access we're working on. But I think, as you'll also see, this is also really a brand new day in terms of the special open enrollment period and the leadership we have from the administration that's really going to, I think, change and do some important work across both North Carolina and across our country to increase access to insurance. The past 4 years have led to enrollment declines and a rising uninsured rate in this country. And although people enrolled in coverage through healthcare.gov for 2021, there is still a ton of work to do. We know health insurance is especially important during the COVID-19 pandemic, and we also know that it's disproportionately harming the LGBTQ community and it's disproportionately impacting people of color. So in a lot of ways, it has really never been a more important time to make sure that we all have health insurance. And that's one of the reasons that President Biden and the Department of Health and Human Services authorized this special open enrollment period for healthcare.gov. And the special open enrollment period kicked off on February 15th and runs through May 15th. So as many folks may know, our original open enrollment period last year only ran for 45 days. So we have double the number of days for this special enrollment period this year. Anyone can enroll in coverage during this time, and many state-based marketplaces are allowing enrollment at this time as well. So these 3 months are going to be critical to ensure people living with HIV, people at risk of becoming HIV positive, people living with hepatitis, people who are LGBTQ, and all of their families can enroll in high quality, affordable health insurance. So to kick things off, I'm going to pass things to our colleague and friend, Mark Van Arnhem, who's the Executive Director of the North Carolina Navigator Consortium and a staff member at Legal Aid of North Carolina. Mark probably knows more about open enrollment and the insurance marketplace than anybody in North Carolina, and we're so lucky to have had him as a colleague and partner in the work over the last couple of years. After hearing from him a little bit about the specifics of this special open enrollment period, we're going to talk about a couple specific things that are especially important to our work at the NCA's Action Network, to the HIV community, to the hepatitis community, and talk about some tools and work that we can do all together around this as well. So Mark, I will pass the floor off to you. Thanks so much for being with us.
Thanks, Lee. I appreciate it. I'm really excited to be able to come and talk to you all this morning about the special open enrollment period that is taking place right now. Like Lee said, when the change in administration occurred in January, one of the president's top priorities was making sure to reopen the marketplace. So folks like all of you on the call and your friends and your family, and people that you work with every day can have the chance to enroll in high quality, affordable health care, health coverage, and have that peace of mind that comes with health coverage, and knowing that you're not just a major illness or a car accident away from losing your home or your car or anything like that. So you could go to bed with that peace of mind knowing that you've got health coverage there if you need it. So the first thing that I want to talk to you all about is that coverage through the marketplace. There's a lot of misinformation out there, but marketplace coverage covers everything that folks need. Prescription drugs, mental health, hospitalizations, doctor visits, free preventative care. All of that is included through marketplace coverage. I know you're going to hear a lot of commercials, especially now and even after the open enrollment periods, where you hear get covered for $15 for next to nothing, great coverage. Those are I just want to say buyer beware there on those. Those are not marketplace plans, so they don't have what are called the essential health benefits to make them a qualified health plan. Like these plans on the marketplace have. So they don't cover everything that you need. They may have clauses in there where pre-existing conditions may preclude you from getting certain types of care. So you really want to look at a marketplace plan if you are looking to find your own coverage, if you don't have employer-based coverage or something along those lines. But like Lee said, the special open enrollment period started on February 15th, and it will run until May 15th. During this time, anyone can enroll. I know that some of the language could be a little confusing to folks that know a little bit more about the Affordable Care Act, as we often refer to special enrollment periods, which are triggered by certain life events, such as losing coverage, moving into a new area, aging off your parents' insurance plan. Those sorts of things may trigger a special enrollment period. So that's 60 days from the life date, the date of that life event. So let's say you aged off your parents' plan at 26. You would have 60 days from that to enroll in a marketplace plan. However, what we're in now is a special open enrollment period. So it's outside of the regular open enrollment period calendar, but anyone can enroll. And I encourage everyone that needs to enroll to come and meet with a navigator from the Navigator Consortium. We are literally across the state from the mountains to the coast, and we can provide safe, remote, a video conferencing type of enrollment appointments. We can even do it over the phone. If you're not internet savvy or don't want to be on camera the whole time, that's totally understandable. I spend all of my day, I feel like, on a Zoom call, so sometimes I just really want to be on the phone, so I don't so I don't have to do my hair before I get on the call. But anyways, I encourage everyone to let their friends know about the special open enrollment period. Let anyone that you work with know about this special open enrollment period. It will run again until May 15th. Then at the end of the year, in November, we will have another open enrollment period on the normal calendar schedule. But between May 15th and November, when the next open enrollment period ends, in order to enroll, someone would have to experience one of those life events. So it's not as easy to enroll outside of the open enrollment period. Now, for folks that are enrolling, I know that there is, the PCAP program is fantastic to help to do the premium assistance. So folks, it would pay your premium if you are a member of the program and you are sign up through PCAP. And Lee can talk a little bit about that, and our navigators can help you with that as well. But for everyone that enrolls, it's for folks to get financial assistance. I see a question here in the chat box. You need to be between 100 and 400% of federal poverty levels to get financial assistance. If you're below 100%, unfortunately, North Carolina has not expanded Medicaid. So a lot of those folks would not qualify for financial assistance. And unless they were in a premium assistance program like PCAP, those premiums would likely be very unaffordable. If you're making under 100% of federal poverty level, you are not likely able to afford a $500 or $600 monthly premium. However, for folks that are between that 100 and 400% of federal poverty level, subsidies do kick in. I can tell you that the average North Carolinian that's enrolled in marketplace insurance through the Affordable Care Act is paying about $60 to $80 for their insurance. Nick is on the line, and I know he could give me the exact number, and I'm embarrassed that I don't remember the exact number, but I think it's like 68. I'll hear after the call if I was right, I'm sure. And that, which is really great, because that's, less than a cable bill for most folks, but it's fantastic for people who have access to the PCAP program and are able to get that premium assistance to help cover the cost of their premiums. The Affordable Care Act marketplace insurance is also great because you're not limited to, with the plans that you select, you're going to go in and find plans that have the doctors that you need, find the prescription drugs that you need in the formulary. Our navigators are all very well trained and well prepared to do that. We have found navigators across the state that we have identified as really strong navigators that are working with a lot of the PCAP consumers. So folks that are taking advantage of that PCAP program, we get them assigned to certain navigators that are very knowledgeable and are ready to sit down and take the time to make sure that everything that you need is in the plan that you eventually select through healthcare.gov. We're not going to be biased and try to just push you in one way or another. We're going to find the plan that's right for you and your needs. That is what we are dedicated to, and that's what we want to make sure happens. I just encourage everybody to go out and to, first of all, if you're not covered, to go to ncnavigator.net or call 855-733-3711. And you can book an appointment right there, either through the call center or on ncnavigator.net. Again, a safe virtual appointment. You don't have to, schlep out and mask up and put on your visors and all that kind of good stuff. You could stay at home in front of your Zoom if you want to, and get the assistance that you need. And the coverage, what's really also exciting is the coverage will start on the first day of the month following the day that you enroll. So normally, if it's past the 15th of the month, I'm going to try to say this where it doesn't sound like a whole jumbled up thing of numbers. If it's past the 15th of the month, your first day of coverage would start on the first day of the not the immediately following month, but the month following that. We are now on an accelerated coverage. They're accelerating the coverage start date. So if you, let's say, sign up on February 27th, your coverage is going to start on March 1st instead of April 1st. That accelerated date of the coverage starting is really exciting to us because we know that people, when they get health coverage, they often want to and need to take advantage of it very quickly. So this is one of the few opportunities to do that as well. I don't know if that accelerated start date will continue into the new administration or into the next open enrollment period with this new administration. That is something that we will find out in the coming months. But we will be sure to keep you all posted. And Nick put the right price in the chat box at $61 a month. Thank you, Nick. Is what the average North Carolinian is paying. So I encourage everyone to please call us, make an appointment if you do not have coverage. If you have a friend, if you have family, anyone who needs coverage, let them know. Navigators aren't just in North Carolina either. If you have friends across the country, have them look at healthcare.gov. There's a tool on there called Find Local Help. And they can find navigator organizations, certified application counselor organizations across the country that are ready to help them to enroll and find a plan that's right for them and their needs. So with that, I will throw it back over to Lee. I'm happy to answer any questions, or we can hang to the end and answer questions then. But I really appreciate y'all's time this morning, and I hope everyone takes advantage of the opportunity to get some quality health coverage. Thanks.
Thanks, Mark. I wanted to see, I saw Margie Storch, one of our great healthcare advocates in the state, raised her hand. Margie, did you get your question answered, or do you want to talk a bit about some of y'all's advocacy work? Margie, you're muted if you'd unmute yourself.
No, Mark answered my question about your income level has to be at 100% poverty level, which I think is about 13,000 for an individual, something like that. But what about people that are like unemployed? Does their unemployment income count?
Yes, it does. Yes, the unemployment income counts. If there is a second stimulus check or a third stimulus check, I think it would be a third at this point. That would not count. But unemployment does count towards their income. They're also estimating their income for the coming tax year. So I know a lot of folks may be furloughed or maybe working a part-time job that just doesn't have the business to keep them, or may not be able to go to work right now because of virus. If you think that you're going to go back to work in 6 months or something like that, you can count your unemployment and then count what you think your income would likely be. The navigator that you would sit down with and talk to is really well versed in helping you to forecast your income and make sure that you're doing it correctly. So when you're reconciling at tax time, there's no issues or anything like that. But there are that unemployment does count. I would like to make a little caveat here that the President's COVID relief plan includes actions in the plan to make make a $0 premium available to folks that are anywhere between 0 to 133% of FPL. Now that's done by taking away by re-looking at Medicaid waivers and pulling some of those waivers. I'm not sure if that'll be part of what finally gets through, but that's something that President Biden would like to do. I know this public option is very important to him, so folks that are in that gap do not continue to fall into that gap in states like North Carolina that have chosen not to expand that.
Awesome. And I did have a couple of folks just sort of ask questions, like clarification. All the information Mark shared is not only specific to people living with HIV. This special open enrollment period is open for anyone and everyone. I'm about to talk about a couple mechanisms and tools that are super specific to like our community within the HIV and hepatitis community. Obviously, there's some new changes within the HIV Medication Assistance program that make this insurance access of greater access to people living with HIV. But all of this information Mark shared is absolutely open to everyone. I know there's a lot of details and specifics about sort of what type of subsidies you might get based on income level. I'm happy to talk through individual cases with folks offline. I know the Navigator Consortium is as well, if folks want to give that phone number a call, but just want to make sure folks understand that distinction. So let's shift, and I'm going to share a couple resources. One thing we hope folks will really just think about doing over the course of these next 90 days, I guess at this point, like what, 86, 84, is just be a champion for open enrollment. The Trump administration really did not educate people about open enrollment. They didn't educate folks about Obamacare. It really wasn't, a priority or focus for them. And so the Biden administration is allocating money, and we understand there's been some money in reserves to do public education campaigns, to speak out about it. But we also can be ambassadors within our own community about the fact that this is available. I'm going to drop in the chat a toolkit that Out to Enroll, which is a targeted group doing work sort of around messaging for the LGBTQ community about the importance of open enrollment, has put together, that has social media guidance, that has framing, that has some graphic images. If you're representing an organization or just yourself want to share this information on social network and to your community as you can, certainly welcome and value that. Then I also am going to share a resource, NC AIDS Action Network, with our colleague Allison Rice at the Duke Health Justice Clinic, put together a tool that specifically looks at the insurance plans in North Carolina with an eye toward HIV drugs, with an eye toward doctors, with sort of a lens toward folks living with HIV. If you are thinking about what plans might be a good fit for you, this second link is a document that's certainly really helpful for folks living with HIV to look at the individual plans in terms of the individual insurers who are out there. We also do want to draw the distinction that for folks living with hepatitis, for folks, in our drug user community, access to insurance is really, really critical. We are still, trying to advocate and ensure that insurance providers cover the cure for hepatitis. That's going to, of course, be ongoing work. We know for the drug user community, there may be, mental health services that folks want access to. Insurance is just such a pathway to greater access, opportunity, availability. So, as we've increasingly done more harm reduction work, more hepatitis, more drug user health work, are really interested in highlighting the value of insurance for those folks as well. I'm going to pass things briefly to my colleague, Matt Martin. Our friends at NASDAD put a new tool together about PrEP access, and he's going to highlight this tool for folks as well and how folks can get information about insurance access and which insurance plans are a good fit for folks who want to access PrEP.
Awesome. Yeah, so I'll be super brief. Hey, y'all. Sorry that I am going on and off camera. I have a very rambunctious kitten who likes to zoom across all over the place, so I tend to kind of go in and out. But it's good to see everyone this morning. I am dropping in the chat the link to the resource that Lee was talking about. This is a really great resource that we got this week from NASDAD that kind of walks through how to ensure that your health plan covers PrEP. As we focus this year on a lot of PrEP advocacy and making sure that folks who are in need of PrEP services are able to access this. We think this is a great tool for folks, especially during the open enrollment period. As of January 2021, most private insurance plans should fully cover PrEP at no cost to you, no out-of-pocket cost. And this is a way to navigate to make sure that your health plan is fully covering PrEP, and it just walks you through the steps to do that. So it's really great, really easy to use tool, and it looks pretty too, which is always great. But definitely feel free to share with your folks, and I think it's a really great tool to ensure that those with private insurance who are interested in PrEP, make sure that they have the right insurance to get PrEP at no cost to them and how to navigate that. So awesome resource, share away, and I think that is it. I'll pass it back to Lee.
All right. So specifically, we referenced a bit that there are some new opportunities for folks living with HIV under special enrollment this year through our state's HIV Medication Assistance program. I think many of you were probably part of some past webinars we did on this topic back in the fall during special enrollment, but just wanted to give an update and fill folks in on some information on that front. NC AIDS Action Network has obviously for a long time been an advocate for a strong HIV medication assistance program. Led the charge many years ago to ensure that that program did not have waiting lists, that it was fully funded, and did work as well to get legislative approval in 2016 for the program to be able to pay premiums and medication co-payments for folks who did enroll in an insurance plan through the marketplace. That program is called PCAP, or the Premium Copay Assistance Program, and since 2016 has been able to cover the cost of, again, medication co-payments and insurance for folks making between 100 to 300% of the poverty level. We've continued to advocate to DHHS that they lift all of those income restrictions, and we're really pleased to see that they did make that change in 2020. So during open enrollment last year, we led some public education efforts. I know many of you who are case managers or folks on the ground helped work to increase enrollment through that program as well. And are really pleased that over the course of that 15-day period, we had successfully more than doubled the folks on that program. So went from around 325 or so people on the PCAP program to more than 700 who are successfully on it today, which I think is a really big success for our community. That change happened really quickly in the fall. There wasn't a ton of time to plan. Obviously COVID has complicated everything. So, doubling that enrollment feels like a big success and win for the community. I'm going to drop in the chat. I wrote a piece if folks want to look into the specifics of that for Q Notes, the newspaper in Charlotte last year that talked a bit about the work we were doing around ensuring folks had access to health insurance and some of the specifics of that program. Do want to flag for people that we do know that there's a small number of folks who were not able to be successful in terms of enrolling in that program, did enroll in insurance, but because of some internal challenges, because of increased enrollment, the state was not successful in making those payments, and folks, a small number were dropped from their insurance plan. We have worked very closely with the Department of Health and Human Services, and they've been sending regular updates out to case managers in the state about making sure that we use this opportunity to re-enroll those individuals. It's a small number of folks, but we really want to make sure that anybody who is in a situation where they were expecting they were going to have insurance, but then didn't, to enroll during this period. You, of course, do have to be an HMAP client. You do have to be eligible for HMAP, which is someone living with HIV making between 0 to 300% of the poverty level. And I know that we're actually, for those of y'all who are case managers on the ground, probably very knowledgeable that re-enrollment is happening right now. So the state has put a really strong team together, has identified the folks who've fallen into that gap, and are working really closely to make sure that case managers get those folks re-enrolled as quickly as possible and hopefully successfully onto insurance plans. Mark drew this distinction, but our timing is really critical right now. If you're one of these folks on the front lines, if folks were dropped, that's the state's priority. Certainly our priority and interest as well in getting those folks re-enrolled. So if they are successfully able to enroll in a plan before the end of February, as Mark alluded to, that will be effective March 1. But if they don't get enrolled until after March 1, then they're not able to be on insurance till April. So it's certainly our interest, and part of the reasons we want to do this webinar to just highlight for the field and the movement that we are in a really critical period in these final days of February to get folks access. We've also been talking regularly. I know some of y'all are case managers and recognize some names. If you do have a client that was in a unique situation where they thought they had insurance and attempted or did successfully go to a doctor visit in January and February and are realizing now that they may not be enrolled, we would really love to talk to you. We have a couple folks who, in partnership with the Navigator Consortium, have used what's called a misinformation special enrollment period to try to get their insurance re-enrolled and post-dated back to January 1. In that situation, it's essentially for folks whose applications were completed by a navigator or an assister of some kind and may have received incorrect information about their plan eligibility, or what's really applicable here is payment information. It can absolutely be unintentional on the navigator side of things, but misrepresentation, payment options, or plan eligibility is an error that could result in your own unique special enrollment period separate from the special open enrollment period that we've been talking about today. So this type of special enrollment is not automatic. It does require an escalation within the marketplace and to CMS, and it can take up to 45 days to process. So we are very interested, and the Navigator Consortium's been working already actually with a couple clients who did have some kind of doctor visit who've concerned about a bill that's piled up in January or February to get misinformation, to get them re-enrolled. And again, a start date would be January 1, which would allow them to obviously have coverage for the first couple months of the year. And I will note that, again, this is a really specific situation, and that individual does have to have worked with a navigator, a certified assister, a broker, or someone with some form of a CMS navigator ID number. You have to be able to point to that individual who may have, again, in this case, unintentionally shared misinformation. If you think, you have someone who falls in that situation, feel free to reach out to me. I think most folks have it. My email address is lee@ncan.org. But happy to talk about individual circumstances and work with the Navigator Consortium to try to get those cases filed. All right, let me pause there. I know we shared sort of a lot of information and resources. Do folks on the call have questions, comments, concerns, ideas?
Lee, this is Scotty from Duke Infectious Disease. I don't handle all of this directly in the clinic, but I had heard from our resource coordinators that ACA plans that had dental and vision were not being supported by PCAP. Is that still true? Is there a workaround for that?
Yeah, I think that was there was some confusion about that, but that is not true. PCAP can cover plans that have dental or vision. And actually, one of the clients who is taking a misinformation campaign to CMS to get their special enrollment period was someone who didn't have binder fees paid because there was confusion about whether a dental or a vision plan could be covered, but they can. And if you have like a person who's in that sort of specific situation, again, feel free to have other folks within your clinic reach out to me to sort of talk through options. Yeah.
Thank you.
Margie, I saw you raise your hand. I'll pass it to you.
did you say me, Lee?
Yeah.
Margie, I understood President Biden supports a public option, but it's my understanding that that's not included in the COVID or re-enrollment program. And if that is true, as I understand it, do you know who the public option would cover, in at least what Biden would push for down the line? Would it cover the people that in North Carolina that aren't covered by Medicaid right now? Do you know?
I mean, I think we'd love that. I mean, I think many of us, myself included, would like to see a more aggressive public option plan. I just because of some of the specificities that we've been dealing with, have not followed that on the federal level too closely. You're right that I know it's not in the COVID-19, no form of that's in the COVID-19 relief plan. Mark, were you about to say something to that?
Yeah, I was just going to say, I think there's a lot that's to be ironed out there, but I know that the real push is to make sure that these folks that are in that 0 to 100% are covered. And no matter what, if they want to take it, I know that that is one of his top priorities when strengthening the Affordable Care Act. So I'm hopeful that it closes the gap, not only in North Carolina, but all the other states that chose not to expand Medicaid, unfortunately, because there are far too many folks that are out there, the neediest among us, that really need this coverage, that aren't able to take advantage of it due to state's failure to act on the Medicaid expansion.
Yeah, I mean, and it's absolutely worth naming, right? And I think something important for our community to think about, right? Like, we have long been active members of the Medicaid Expansion Coalition in the state. I still laugh, like there's an article from North Carolina Health News, I think from 2017, where we were hosting a Medicaid Expansion Advocacy Day. Margie, I think you were there. I think you're in one of the pictures with me. And Rose Hoban interviewed me and asked, like, well, why are y'all even here, right? Medicaid expansion's so hard. And I have like the most Pollyanna quote. It's like, well, we just got to keep drumming the drum beat and like eventually it'll happen. And here it is like 4 years later, and we're still sort of struggling on that front. If we were to see Medicaid expansion and the gap closed in the state, I think it is worth naming for folks that we'd likely see a fairly big shift of folks from the HIV Medication Assistance Program move to Medicaid. Expansion, I think more than half actually likely of folks might move over. So, we've often talked about the premium assistance program as in fact sort of a form of Medicaid expansion for our community. It's obviously a different type of insurance, right? It's private insurance that's subsidized rather than, well, again, Medicaid is shifting to a managed care system that's a public-private partnership. But I think it speaks to the value of insurance, right? That we've been able to achieve this for people living with HIV, that we know when people living with HIV have full insurance rather than just their medication, they get better viral suppression rates, right? And it would be nicer if we could take bigger bites of the apple of this rather than having to keep piecemealing it. So I think that continues to be the work for all of us. I did see two things in the chat. Yeah, my colleague Dante Prayer has been a real partner in moving this forward, helped manage our mini grant program during public education this fall. His email is dante@ncan.org if anyone would like to reach out. And then Judy asked approximate numbers. Judy, I think the most recent number that feels pretty solid is it's a little bit above 200 individuals who attempted to enroll in insurance plans but were unsuccessful because the state didn't make the binder or some form of payments. I know we're pretty confident that over the course of the special open enrollment period, we will be able to move all of them onto insurance. It may just depend on how long and how much time that takes. Other questions, comments, thoughts?
Lee, this is Scotty again. Just a plug, I guess, for PrEP information for those people who don't have a plan or below the poverty level. Duke has charity care for the visits and the lab work coverage. And of course, we have patient assistance funds for the medications. So if that's a good option for people, we'd love to have you at the Duke PrEP clinic.
Yeah, I think we've, continue to feel really strongly that like one of the solutions to getting more folks onto PrEP is helping with the insurance piece of it, and or the cost, whether it's insurance or the other costs, right? I think we often hear from folks that it's not necessarily the medication they can't pay for, it's the doctor visit 4 times a year. So appreciate folks like Duke has an excellent clinic, other places around the state are trying to figure out how to do that. But I think we often really focus on this type of insurance work just around people living with HIV, and it's so critical to our PrEP and PEP advocacy work as well, and getting folks access to those prevention methods. Any other comments, questions, thoughts, or concerns from anybody on the line?
Is the Duke Prep Clinic in Durham?
I believe, yeah, I think so. But Scotty, I guess I should pass that to you.
No, you can talk for me. I don't care. It's kind of a PrEP clinic by name only. It is the Duke Infectious Disease Clinic, 1K, at Duke. On Wednesday afternoons, we cut out the 1 to 4 time period. We mark that off for our PrEP clinic. So I guess I don't know how to say that, but it's not a different clinic. It is our clinic with the hours of Wednesday 1 to 4. And of course, if there's a problem with that time frame, we can work around that for other times. But it's nice to be able to focus our resources that afternoon from Wednesday 1 to 4.
All right. Well, I think we're going to wrap up a little before 11 today. As I said at the start of the call, we are going to announce our next 2 webinars. So as we do that, if folks have final questions, comments, thoughts, feel free to drop that info in the chat. Matt, I believe I'm passing it to you to talk about our next 2 webinars. Is that correct?
Yes, indeed. We do have a couple of webinars continuing in our series of Thursday morning meetings. Just to put on your radar, we'll also be sending these out in our follow-up email today, just so that you have that information. But on Thursday, March the 11th, we'll be joined by Jesse at the North Carolina Harm Reduction Coalition to talk about the history of drug user health. So that's going to be a really great conversation. And then 2 weeks after that, on March 25th, we'll be joined by the UNC Care Cab to talk about the COVID vaccine, specifically for folks who are living with HIV. So 2 really great conversations, March the 11th and March the 25th. We'll send both of those along in our follow-up email today, as well as the resources that we shared in the chat today, just to make sure that all folks have access to those. But would love to have y'all join us on Thursday mornings in March.
Awesome. Yeah. Thank you, Matt. I think, we were doing these every week at the height of COVID in the summer. And I think as the world is adjusting to the new normal, that felt a little bit more than needed. But it's always kind of nice to bring our community together and have a chance to sort of check in and say hi. So our planning through, I think, the coming weeks and months to be every other Thursday morning at 10 a.m. to have a conversation and presentation like this. So. All right. Well, again, feel free to reach out and be in touch. As Matt said, we'll forward some of these informations in the webinar recording later today. Thank you to Mark and the Navigator Consortium for all they do to help us and support the work in the community. And we will let folks go a little bit early. So enjoy the rest of your day and have a great week. Thanks so much.
Thanks, guys. Bye-bye.